As you all know that we are working under an NGO called Career Guidance Council, and our aim is to uh, help job seekers with getting a right job, helping them with the right training, technical training, soft skill training, helping them keeping informed about what are the opportunities are available. So this kind of webinar also usually we used to conduct, and our main aim is to improve the education system in this nation and help people with the right kind of education, help people with the right kind of guidance required to get a job. And this platform is open for everyone, student, job seeker, and professional. So usually this kind of webinar we used to conduct, and today we are very honored to have Mr. Ishaq Quadri on speaking on the healthcare industry. Over to you, sir. Thank you.
Yeah, thanks, Shoaib, for that nice introduction. And I'm indeed delighted to be here. I know Career Guidance Council has been doing yeoman service with regards to the career building of individuals, which finally translates into nation building. So I really salute and thank the entire team for organizing this webinar online and having me here. So I'm really delighted as well as thankful to the entire team. So as Shoaib has rightly mentioned in the very beginning, at the very word go there, a few quick things about healthcare. No better time or no difficult time than what we are currently experiencing globally due to the COVID-19 pandemic. And in this context as well, there is a renewed interest. There is a lot of inquisitiveness that the whole entire global community is going through and experiencing at this juncture. So in that sense, also it is very apt for us to kind of pay attention to this often neglected sector, I would call it, for a multitude of reasons, and I'll talk about that a little later. So before we begin, there's just one slide that I just wanted you to pay attention to with regards to what are the overall statistics that we are talking about, okay, when it comes to healthcare. So we all know that the global human community has got close to like 8 billion in numbers today, like 7.8 billion to be exact there. And every individual, okay, may fall sick. Every individual will require healthcare. So that's the amount, and that's the kind of magnitude or the size of the population, or looking at from a customer's perspective that we're talking about. Like we're talking about the entire global community to be the consumer or the customer base as far as healthcare is concerned. Coming to India, if you know, I think a lot of people today must be researching on these topics, like because we keep hearing that very soon there may be more tougher situations that we are in right now. Things could become worse. This could really lead to a lot of panic and chaos and confusion. So how well are we prepared from a response perspective, from an infrastructure perspective? So roughly, if you know, I mean, for this is live statistics coming in, we have like 70,000 hospitals in this country, and there are around 19 lakh beds. So for a country of 1.3 billion population, okay, we have 70K hospitals, both in public and the private sector there, and then we have 19 lakh hospital beds, and we have roughly around 95,000 ICU beds and just 48,000 ventilators. So although it may sound that this industry has grown quite big, and you see hospitals all around, but still, as far as India's statistics, there is one measure here which is called as the hospital beds per 1,000. When you look at the statistics of hospital beds per 1,000, we are really lagging behind very royally there. So it is somewhere around 0.5. It's not even one bed per 1,000 people in this country. So that's the kind of size and scale and potential that we're talking about. Okay, obviously I'm talking this in the context of careers and skills that we wanted to slowly get into right now. Now, apart from this, why the hospitals are overflowing with patients. There is the education levels have improved. People know what are the do's and don'ts, and still, why is it that the hospitals are overflowing with patients? So there are 2 to 3 very important reasons why this is happening. The number one reason is the life expectancy has grown, okay, which means that we have a lot of people in the later half of their age. So for example, 50 years back, the life expectancy was somewhere around 50 plus years. Today it is in the mid of 70s. We're talking about 74 years is the average life expectancy today, which means that we have a lot of growing elderly population across the globe we're talking about, and that is applicable to India as well. There is a growing disease burden. This word you might have heard earlier, that there is something called as the disease burden. What this disease burden is all about the kind of diseases that we keep hearing. For example, cancer. It used to be something which is very remote and not very directly connected to us. But today you see all around people are there which were cancer patients. So the disease burden in terms of the cardiac to cancer to kidney related to asthmatic patients to all that overall disease burden has increased. And there is an increase in the lifestyle related diseases, what we call as the NCDs, the non-communicable diseases. Okay, these are, you might have guessed it by now, diabetes, for example, is a lifestyle disease. Okay, cardiac problems that we are seeing. So these are chronic issues that we are getting into. And these are, earlier people used to die, a lot of them used to die with communicable diseases, and today we are seeing a lot of non-communicable diseases. So finally, also the reason why hospitals are filled with people is, okay, there is a focus on wellness as against illness. So not only the ill patient, but also people who are doing well, but again, they want to do better, are getting admitted. And the hospitals also are focusing a lot in terms of, taking care of these patients in a very proactive manner and doing a lot of tests, diagnostic tests. And finally, there is a lot of negative in the sense that people are getting panicky also about that. So this is just a background of the healthcare stats globally, as well as what do we have here in India. And the next slide is a quite an interesting one that I just wanted to share. Okay, so let me, yeah. So if you can see that there is a picture on the left hand side, okay, which I called as the older picture or something in the past, and then something on the right hand side is the new. Okay, so the old was what we call as a maternity home, okay, and the right hand side, and those of you who are joining from Hyderabad know this brand very well. And in fact, this is the same hospital where I myself was born. So the picture on the left is what I am more able to associate with as against the right one, which is the current scenario. This is not promoting this hospital at all, but just to give you a perspective as a sample here. So how healthcare has changed, right? You can see it very clearly that a small, what we call as a boutique hospital or a nursery care center or a nursing home or a maternity home, okay, has transformed into a multi-speciality, modern, mother and child chain of hospitals and all that. Okay, so this is what the kind of transformation that has taken place, and that was just to get you into a more detailed stuff of what has happened when you consider the hospital of the past or a nursing center of the past, okay, as against what we see today on the right hand side. So the previous nursing homes or the maternity homes were usually driven by an individual doctor, a very accomplished man, okay, a doctor who has really come the hard way and he has got a fame and he has established himself, and he used to, okay, open a 10-bed facility or a 20-bed facility, and it used to be a family-driven business there on the left-hand side. If you look at the new age, it's all corporate governance structures and all that. So let me complete the left side first, and then we will come to the right. So it used to be a individual doctor, okay, or family-driven, and it was usually a charity or missionary service. Okay, it was it was the kind of fee which was being taken was just to keep them afloat, as we call it, right? So it was just to take care of their expenses and maybe a little bit of salary for the promoters and all. So it was more of a charity and missionary service. It was meant for a specific specialty, as I said, a maternity home, okay, or it could be like a cardiac center, a very small center which is specific to a given specialty. I still remember there used to be this nephrology, related, like specific small hospitals used to be there. There used to be ophthalmology related, eye care centers used to be there, associated with some very one famed individual. Okay, and he used to run the show. Then the next aspect of these old style, traditional hospitals was they never used to prescribe too many lab tests, and there was no such focus on doing too many testing. I mean, it used to be famous that a good doctor is the one who will not prescribe too many tests. He will look at the patient and look into his eyes and say everything about it. Okay, I myself have gone through some of these experiences, to be very frank there. The limited usage of equipment. There's hardly any equipment. Okay, we remember that stethoscope plus a BP recording, is what they used to do, but nothing beyond that in terms of the equipment. Okay, and manual recording and registers. If at all they were having some process, it was all manual, written in like the paper-based registers. So that is what was the hospital of the past, like which a traditional hospital of the past, which I'm describing on the left-hand side. But when you move on to the right-hand side, okay, the new age hospital as against the one, a corporate governance structure, okay, private and funded institutions, okay, they are all, a lot of them are in the private sector and they are all funded institutions. Specialty and tertiary care centers and quaternary care centers, multitude of lab and radiology tests done because they want to be sure. Nobody wants to take a call or risk for whatever reasons. Extensive usage of equipment. And finally, last but not the least, they're all like technology driven with end-to-end digitalization. This is just to give you a picture or a preamble for my overall talk here, just to get you introduced to the topic here. And if I put this in a graphic on what all kind of technology that has kind of entered into the healthcare space, you name it, okay, everything and anything that you speak of today from a technology perspective is there, right from data analytics to telemedicine to social media, and then the mobile applications and the huge proliferation of the mobile medical devices, what we call as the medtech companies have really kind of made their mark today. And finally, we have the robotic surgeries happening, drones and the autonomous devices taking place. Sorry, yeah. So having said this, okay, from a technology adoption, what is happening in healthcare, okay, so coming to the real topic of today, which is about the career avenues, right? I mean, what are the skills required for the new age healthcare? What kind of avenues do we have? So just broadly, I mean, at a very high level, if we have to divide, there are basically 5 potential areas or avenues one can look at as far as healthcare is concerned. Okay, the number one is public sector, or what we call as the government hospitals, right? The hospitals in the government or the public sector, and the government departments, the various central and the state government, various departments will be there to take care of the healthcare of the general masses. So that's the number one, which is the government part of it. The second is the private sector hospitals, which has gained a lot of importance, and they have literally captured the whole imagination of people, at least in the urban areas of today, and all the metros and everywhere, where you see all of them like mushrooming and flourishing like anything in the private sector. And the third aspect is about the research centers, right? There's a lot of healthcare research that happens. I will talk about it later. And IT companies, obviously, when we are saying that there's a lot of technology that is required, so is the reason for the existence of all these IT companies who need to make these solutions. And last but not the least, certainly, are the NGOs who are bridging the gap, okay, who are doing the advocacy for the patients, who are the ones who are making the ends meet as far as the access and affordability of healthcare is concerned. So these are the various avenues which are available for anyone who is looking at making a venture or advancing their careers into healthcare. When we look at the hospital, there are primarily four different types as far as the classification goes. Okay, we start with the primary care center, which is the first point of consultation, where very basic tests are done just to know whether to confirm or to disprove or to know or to eliminate a certain doubt. So that's the first point of consultation happening there. The basic care can take place at a primary care center. So a small clinic next to your residence could be regarded as a primary care center, but in the public sector, there is a proper definition of what a primary care center is. Okay, where we call as only the outpatient is done there. You cannot admit a patient in a primary care center. That's the basic hallmark of a primary care center. A simple diagnosis can be done. There can be a pathology lab. They can do some simple lab and urine tests and all that. So that's the definition of a primary care center. And then slowly we move on to the secondary one, where there will be slightly specialized care will be provided. Inpatient facilities available here, more sophisticated diagnosis, and hospitalization, which is about inpatient care facility. Tertiary care, again, it's a bit again on the higher side in terms of the complexity of the ailments that they can cater to. It's usually a multi-speciality, which means like a multitude of specialties are available there. Infrastructure is better as compared to a secondary care center, and these are like more skilled resources. And finally, the quaternary care centers, highly specialized services, usually very niche in terms of what they do. We call it as experimental medicine also, like something which is state of the art and something which is emerging, okay, not yet tried. And people who come here also are mentally prepared for it. Yeah, we have tried all our best and things are not working, let's give a try here. So they do that, and that is where a lot of research happens, and they do a lot of state-of-the-art surgeries using robotics to trying out with new medications to therapies and all that. So that's as far as the quaternary care is concerned. So this is the classification of the hospitals. Looking at the, so now we are kind of getting into the hospital. We're kind of zooming in. Let's say we are getting into the secondary care hospital here. So what all kind of departments or various facets that you would experience there when you get into say secondary care, inpatient hospital there. Okay, there are two broad categories that we can classify here. I mean, this is more for understanding. Okay, one can say there are like three categories or four that can be disputed, but broadly, at a gross level, there are two categories. One, what we call as the clinical or allied or therapeutic services, and the other is the non-clinical or the administrative services. In the clinical category, you have the doctors, whatever services that the doctors are offering, the nursing, diagnostic, pharmacy, dietary, and therapists, and it goes on. I mean, there are more things to do there. The other part of it, which is the non-clinical one, are the ones where they are into the management or administration of the patient, right from admission, discharge, and billing to finance to biomedical, information technology, HR, purchase, housekeeping, engineering. So that's as far as the various grouping of the services of the department goes. Yeah. Request everybody to mute, please. Yeah. So also looking at the overall org structure, it is no longer okay that small team handling the entire nursing center or a maternity home. Okay, it is driven by a board of directors sitting right on top, who will appoint a chairman, and under him he will appoint a chief executive officer. Okay, then again you have the medical superintendent, under whom there will be like clinical departments, lab to radiology to all those clinical services will be there. And then they have the various departments, internal medicine to cardiology to nephrology. So you have a multitude of various departments there. And then you have the administrative team also. So there is a CFO, the chief financial officer, the chief operating officer, the chief purchase officer. There is a very strong purchase teams in the hospitals today, because the amount of purchasing they do is like humongous. Chief operating officer, chief nursing officer, and then in some cases the chief nursing officer reports to the medical superintendent also, in some cases, they report to the CEO. There are a variety of these combinations possible there. And finally, last but not the least, the CHRO. The CHRO is the chief health officer. So, so that's the what do you call the org structure that we are talking about in terms of the vastness and the complexity. Sorry, the chief. I said CHRO is the chief HR officer, the human resources officer. Sorry about that. So that's the org structure. Now, here is one quick slide to kind of get this point across. Okay, that what kind of technology or adoption of technology that we're talking about in terms of a modern hospital today. Okay, just to give a picture, the top picture is of operation theater. You can imagine, I mean, kind of gadgets which are put in there. You can imagine the kind of technology which is required to build out this. Okay, this is a regular, okay, what we call as the OT today, the operation theater. Okay, OT of today looks like this on right on top there. And at the bottom, if you can see the ICU related one picture of an intensive care unit, and in the middle that's a PACS, the radiology or the PACS. Okay, and the right hand side is the CT scan. And this is just to give you a glimpse of where technology okay has finally gone into in terms of healthcare today. And here is a typical hospital IT landscape today. I mean, from a technology standpoint, from an information technology perspective. Okay, this is my favorite slide. Obviously, as a consultant, I keep using this in almost all of my consulting, presentations. So I should be applying for IP here. So basically, if you see here, you right from the bottommost layer of policies, of standard operating procedures to skills to training. Okay, you have the hardware layer, you have the OS and the middleware layer, and then you have the applications layer here, and then you have the various online solutions as well as the new age teleconsulting. You can see the e-consultation right there, the patient reminders, okay, the tele-ICU where you can remotely monitor an ICU, and the e-learning, which is also assumed a lot of importance today, online reputation management to social media management to intranet and email. So today's hospitals, you'll be surprised, have most of these boxes that you see in place. Some of them okay have just recently started, some of them are planning for it. For example, you see the ERP also sitting right there in the middle, correct? And a lot of you must be familiar with the most common ERPs of the world today, like I don't have to name them. And then there is the HIS, which is the Hospital Information System, which is the main system for billing and admission and discharge of the patients. And similarly, you have the EMR right on the left-hand side corner there, the EMR, the Electronic Medical Records. So picture archival system, the lab information system. So these are the various applications which are used today in healthcare or in hospitals. So this brings me to the end of my first section, which is about the introduction and about the new age hospitals, what all do they offer in terms of the various services, as well as the kind of technology being used in these environments and setups. So as a summary, we looked at the need and potential of healthcare, which is very high. The industry has grown, but still the demand is going higher there. The technology adoption, although late, is making significant impact. Why do we call that the technology adoption in healthcare is late or delayed? It's because if you look at other industry segments, when we compare it with, say, retail, where is retail today, right? I mean, it has gone much ahead. What about banking, right? So when we do a comparison between retail, banking, and healthcare, you see a huge gap there. But at the same time, this gap is getting narrower and narrower. Some 10 years back, we used to say that the gap is 20 years. Okay, I used to say that according to my own observation, it is looking 20 years behind. But today, that gap has got reduced to say around 7 to 8 years. When you do a comparison between what all technology and the convenience that a retail store or a bank is offering you as compared to a hospital, a lot of things are advancing very fast. And I must really say that okay, there are sometimes very unfortunate situations also which we need to the advancement of a certain area. And the recent, the current COVID-19 crisis also has pushed telemedicine, which was lying in the shelves and was being unused and just not regarded so important, to be very high in terms of adoption today. And finally, there's a dearth of new age skills and competent workforce. So that's the good news for the crowd who have attended today, and I'll be elaborating as to why it is so. So now coming to the skills and courses which are available. Okay, as you all know, in a traditional hospital, okay, like I said just now, based on the requirement that we need to have the clinical and the non-clinical skills. Let me go back to refresh your memory there. Okay, this slide I'm referring to. So when we spoke about the clinical and allied or therapeutic ones to the non-clinical ones, now we'll see what all skills are required in each individual area here. So we need clinical, we need management skills, right? We need people who can manage the overall finances of the hospital. We need people who can manage the overall operations of this hospital. We need people who can manage the overall people side of the hospital. Okay, so that's the management skills we are looking at. We are looking at administrative skills. Okay, the mundane tasks that need to be carried out, right, from housekeeping to the drivers to the ambulances. So administrative stuff has to be taken care of. The delivery of the food in time. Then we have the nursing services to be provided. Okay, so we need skills for the nursing part there. The paramedical services, we'll come to that. What is paramedical services we're talking about here, right? From pharmacy to physiotherapy to biomedical engineering to all that. We need information technologies skill sets. Okay, we need people who have very good IT skill sets. We need biomedical engineering skill sets. So these are the overall skill sets that we require. And to take care of all this, what kind of courses do we have? So let me start with the medical courses. This will be very easy for all of us because we have been brought up with these statistics and these courses, and we are all quite well aware. I need not spend time at all on this slide, right? From MBBS to we all know what is BDS to BSc nursing, BPharma, and then PharmD to the BAMS. Okay, so the BUMS, the Unani medicine, to the Ayurvedic medicine, BAMS, the Ayurvedic medicine. To so I'll just flip this slide. Okay, and then paramedical courses available. Yes, maybe we can spend some time here. We have a lot of bachelor's courses as far as the paramedical services are concerned. Okay, for example, the operation theater technology. Okay, BSc in biotechnology, X-ray technology. Okay, radiography and medical imaging. This is meant for the radiology department. For the dialysis department, again, there's a BSc in dialysis technology. Okay, there's a BSc in medical laboratory technology. So there are all these graduate courses available for the various aspects that we spoke about in the beginning, right, from the lab to radiology to the ICUs. Okay, so right from the ophthalmic technology and BSc in that to Bachelor of Occupational Therapy. So we need a lot of therapists today to take care of people who have got depression, people who need a lot of therapy, and occupational therapists come very handy there. Speech therapy is one area. Then physiotherapy has become very important, right, from sports medicine, like all the athletes require it, and also from accidents to people recovering from any kind of injuries. Then you have microbiology for the various labs, forensic science, very important to do autopsies on the patients, pathology for all kinds of pathology tests. So these are all the graduate courses. Okay, this recording will be available, so there's no need for you to worry about that. Okay, there's no need for you to take pictures of the slides and all that. This will be available as a recording and will be made available to all the participants today. So in a nutshell, if you have to summarize this slide, these are all the graduate level BSc level courses available, okay, for the paramedical. And there are more in terms of the diploma courses. Again, the same courses that we just now spoke about, most of them are available as diploma also. If anyone wants to get into a short-term 1.5 year diploma or 2-year diploma, a lot of these diploma courses are available, and you can spend time on it later on. Anyway, the recording will be available. Next is about Okay, some of the other courses, like they may not be falling even in a diploma, but very short-term courses like the ECG assistant, for example, dental assistant, for example. There are 6 months kind of courses available, but I would strongly recommend people to go in the order that I presented. Okay, try your best to get into a degree course like the MBBS, okay, the BDS, okay, and all of that. You get into that. If the luck has not been on your side, you've tried your best, get into a bachelor's courses which are listed here, okay, wherein you can get still a degree, and then go ahead with the diploma, and finally, even after doing all this, or maybe you are migrating from another area to healthcare. You are moving, or you are migrating from a non-healthcare to healthcare. These small courses may come very handy as far as getting yourself oriented towards healthcare is concerned. So this was a very short brief on the overall medical, paramedical, and courses. So I have a specific focus on what all digital health has brought to the table in terms of the medical informatics. Okay, and I'm sure a lot of IT professionals would have joined today. They must also be eager. Is there a career path for me? Is there a kind of a roadmap for me to also get into healthcare? You could be a person currently maybe focusing on, say, retail, or maybe you are into manufacturing, and maybe you have an interest of I do get excited when it comes to healthcare. Are there any avenues for me? Yes, certainly there are. So first and foremost, this is the body that I am associated with. It's called Health Information and Management System Society, which is a US-based not-for-profit organization. I'm the secretary of the HIMSS India chapter. So you can go through the website called himsslearn.org, himsslearn.org, which is given right on top there. Okay, there are a lot of courses, and a lot of courses have been made free, okay, right now because of the lockdown also. So I mean, you can get really benefited. I would strongly recommend you all go through this website and look at specific topics. As you can see on the left hand side, okay, the topics are already listed there. It starts with analytics. I'm sure you can see that the topics on the left hand side there. Analytics to artificial intelligence, blockchain, okay, and general careers, right? Edge computing, what is electronic health record, finance. So these are all healthcare related specific topics that himsslearn.org is covering, and those courses are very much available there. And I will talk about the CP HIMSS label that you see right on top here a little later. So this is the first takeaway as far as the specific courses on healthcare IT is concerned. And there are a lot of short duration online courses. I'm sure by this time a lot of you must be already familiar with Udemy. Okay, and so they have these courses. One of their flagship courses on the healthcare IT front is called CompTIA. Okay, the CompTIA, it consists of 100 lectures. Roughly, it is like 4 hours duration each, and very basic course focuses on regulatory aspects and healthcare IT security, workflow models, and all that. So people coming from the healthcare background will be able to catch up with this. From the IT background, will be able to catch up with this very fast. Introduction to FHIR, which is the HL7 standard. We can go through that. Certified electronic health record specialist, EHR specialist. As I said, you may be coming from a non-healthcare background, and you can certainly jump into it and claim yourself to be acquainted with the electronic health record related aspects there. The other portal, which is also very famous these days, I'm sure you all would have tried it out, is Coursera. Okay, it has got a e-health course, online course for 15 hours. Okay, you can go through that, and healthcare data literacy related courses also there. There are a few more short-term courses which are offered by the government, other agencies. So I would also recommend you to go through that. Okay, CDAC, which is the Center for Digital and Advanced Computing, okay, which is the Government of India body, has got some very good courses online. You can go and check it out. And distant education courses are there, as well as in-person attendance courses. There's an international body called as International Society of Telemedicine and E-Health, ISFT. So it has got courses on telemedicine and e-health. And the Apollo Hospital promoted MedVarsity is another an online destination for your courses, for short-term courses. HIMSS, the same body that I spoke about just now, okay, has got 2 certificate courses as well, which is called as the CAHIMSS and the CPHIMSS. Okay, this is a certified associated health informatics, which is an 8-module self-paced learning course, and another one is the certified professional in health information and management systems. So you can go through the website. Okay, these courses are very much, all the details are available. You can do these courses sitting right here in India, although they are offered from the US. And a bit more long-term courses, if you look at it, Tata Institute of Social Sciences, another place where I teach, based in Mumbai. It offers 2 very good programs on the for the health administration, which is the masters in actually it is hospital administration. Sorry about that. So master in hospital administration and executive PG diploma in health administration, which is the EPGDHA. Which is the course that I teach. Predominantly, it is overwhelmed by doctors. So in my last batch, I had some 59 students, which was quite big, according to my own understanding. And 53 of them were doctors who had come from all across the country. So there is a lot of interest in the medical fraternity also towards healthcare IT. So I teach IT there to these students. So the IGNOU has got courses, and then there is a institute called IHMR. I'm sure you would have heard about it. If not, you can go to their website. Okay, it is the International Institute of Health Management and Research. They've got 2 facilities, one in Delhi and one in Bangalore. And then there's a Mahatma Gandhi University, which is based in Jaipur. And then you have the IITs and some of the foreign universities as well listed over there. So this was about a brief about the careers. Okay, just to kind of summarize, we went through the very long-term courses, right from the MBBS to all that, and then we went over the paramedical courses, and then we looked at the digital health, and finally, looked at some of the very short-term courses. Okay. So the reason I took this path was like, what is the destination, and let's look at some of the career opportunities, right? So we looked at the demand, and then we looked at what all are the vehicles or the tools with which you can reach there. But as the end result, okay, I purposely kept these opportunities part at the end for the excitement to be held up till then. Okay. So what are the emerging careers when we talk about? Believe me, these are only the emerging careers. I'm not talking about the traditional ones here at all. Okay. So Chief Medical Information Officer, right? The CMIO, a person who has got, who has already got a career on the clinical side, and now he or she has transformed into an IT person. So that precisely, and he or she is the head of that, at a hospital level, the CMIO. Then you have the Chief Nursing Information Officer, the same way for the nursing. Chief Information Officer, which I have been one of those, which have played the role in some of the hospitals until recent, and I continue to do that today. And then the list goes on. As you can see, the Vice President and GM systems, and believe me, these are all real designations in the hospitals today. This is no exaggeration. Don't tell me, oh, do we have data architect in hospital? Yes. There are data analysts? Yes, we do have in hospitals today. So on the left-hand side, you have the IT heads. A lot of places, a lot of these IT heads report to me. So these are the people who are the field in charges. Okay, one of them is heading the application, the other is heading the infrastructure, for example. Application systems managers, system administrators, very highly skilled people who can look at the virtual machines, to hypervisors, to they can manage the whole infrastructure sitting in one corner, and then they can look at the entire cloud infrastructure there. A security administrator, very important, because thanks to all the kind of hacking and the kind of security breaches that keep happening on the global scene that we keep hearing of. Medical informatics domain specialists, okay, people who have spent a lot of time in this area, and they become very well aware of the processes which are required from a medicine perspective as well as information technology. So hospital information system and EMR product specialists, technology architects. So you can read it, and I'll not go through the list on the right hand side. Very easy to understand. I'm sure with the IT folks, it is something which they know day in and day out. They have been working on it. So these are the various emerging career opportunities. And also you must be wondering, okay, is this the end? Like, when we look at the various hospitals, correct? Is that the only destination or avenue for us, or do we have more? So the next thing is about the IT companies. Now, a lot of IT companies are coming out with a lot of products. Okay, they have a lot of software products. Like I said, the electronic medical records or the HIS, the hospital information system, correct? A lot of these solutions are already there in the market, and so many of them are still being built. So they need skilled resources. They need people who can manage the whole team. They need very senior management folks there. They need domain specialists. Okay, domain specialists are maybe the doctors with an acumen for IT. Okay, so they need a lot of domain specialists. They need the software developers. Okay, they need all kinds of .NET, Java, to all kinds of developers are required. Okay, your full stack developers to the UI, UX guys, the entire mobile apps, DevOps, all of them are required by these IT companies. Okay, and finally testing and administration and all that. On the services side, okay, this is a small representational list that I have tried to oversimplify, keeping the today's crowd in mind. Okay, for this webinar, the call center, okay, is a good example. There are a lot of companies who are offering these services of appointment and patient follow-up. Okay, they are taking this as an outsourced service from hospitals. Medical transcription, you might have heard already. Correct, a lot of work happens. Okay, but that is getting changed because of the EMR adoption happening. The revenue cycle management. So revenue cycle management is quite intense in the West, where this insurance is very strong. Okay, both for the inpatient as for and for the outpatient. So this is all about the claims management, getting the claims for all the insurance companies and ensuring that the hospital gets their revenue. So that's a revenue cycle management. Then you have the remote patient services, right? A lot of remote patient management is happening today. Remote ICU management, remote critical care, home care, right? A lot of those remote management services are taking place. So that all falls in the remote management category there. Digital marketing, websites and online presence. I mean, as I said, this list is quite an exhaustive one. Okay, I have put a few most important ones. So people who want to be a part of the healthcare, they can either join a hospital or they can join an IT company, and these are the various things that the IT companies are doing. There are a lot of startups who are doing some very exciting stuff today. You might have heard about interoperability that they're working on. They're coming out with a lot of wearables and devices, for health monitoring and all that. So that's the exciting area for a lot of people who want to kind of get into this space. Research organizations also, they have increased, and they are doing a lot of work based on all the factors that we spoke about in the beginning of this webinar. What kind of research happens? Population health analytics. This is all about community health at a macro level, like what is happening in our country, which state is doing well as against the other state, what are the reasons behind it? Is it because of education levels? Is it because of the financial well-being? Okay, that is what is the population health analytics. Looking at the outcomes, what all kind of interventions are helping in terms of eradication of a certain deficiencies in a certain area. That's all about population health analytics. And then you have drug discovery, the clinical trials, and the various outcome improvement programs, which keeps happening in the various research institutions. What kind of skills required? Doctors are needed here, academicians are needed, a lot of people with statistical data background, data scientists, and finally, last but not the least, a lot of software professionals, are also required. So that's about the health research organizations. and which brings me to the end of this webinar as far as my talk goes. Okay, I will pass it back to Shoaib or Wahid to guide me on the questions, if there are any on the chat at this juncture.
Yeah, thank you very much, sir. So I request everyone to please ask if you have any question in the chat box. Sir, we